Did you know you can support the Lipoedema podcast just by using our affiliate links?
When you shop the products and services we recommend on our website, we may earn a small commission at no extra cost to you. Every dollar goes straight back into creating more episodes, more stories, and more resources for our community.
We only share things that we genuinely use and love. To browse our listener special offers, head to the lipoedemapodcast.com.au.
Quip it.
Welcome back to the Lipoedema podcast. We are your hosts, Shell.
And Tiana, and today we have a return guest, probably the number 2, episode 2 of 3 with our lipedema warrior, Diane Romano. Hello.
Hello, girls. How are you?
Good, thanks, Di. How are you?
Good. Thanks for having me back on.
Oh, thanks for coming back on. And if you would like to listen to Diane's lipedema origin story, then please go to episode 118.
118.
Yeah, 118 is Di's last episode. But there's been some progression, Di. So you are like a week away from your surgery.
It's around the corner.
And this is your third surgery, yeah?
First and hopefully only.
Okay.
Yeah, so it's daunting because it's this time next week. Oh
So-
my God, yeah.
Friday next week.
No, well, hold on. What's the date? It's not this next week. We're like 10 days away, just over a week.
And
This
it's
time
coming
next
up
week,
very-
I'll be like, it's around the corner.
Yes.
Yeah.
I mean, it is around the corner, really. Like 10 days
yeah.
will go so quickly with life and everything.
Yeah, I know.
Talk to us about how you've been feeling in the lead up to your surgery.
Oh, I have been so anxious the past couple of weeks, just with not knowing what to expect. Everyone has such a different experience, and everyone's procedure is slightly different. Like I'm having what is known as legs 360, but other people do lowers, other people do uppers, or they, break the surgery up, or they might do, it's just a different procedure. Everyone's procedures are different. Everyone's recovery, pain threshold, everything's so different. So yeah, it's the unknown for me. It's like childbirth, right? Everyone has their like a unique birth story, and I feel like that's the same with this surgery.
Yeah, and even if you have a birth plan, it doesn't usually go to plan.
No.
So you're sort of going to be
Yeah.
ready for anything that could happen or come your way.
Yes, and I think because I don't know what to expect. Like the surgeon's given me some really good advice on the after process. Not having gone through it before, it's the unknown. That's the scary part. I don't like change. I don't like things that I don't know how to do.
Yeah.
I don't know how to do this yet.
Yeah.
That's so true. And considering it's hopefully your like one and only surgery, like that can be a blessing and a curse. It's like, because you want to be prepared, you can't be prepared because you don't know. But also, if you are going to go into that second surgery, that anticipation of knowing how you're going to feel sometimes puts you on a back foot as well.
Yeah, that's it. They say that about knee surgery. Like they like to do them both at once because if you get one done, you won't get the other one done.
Yeah.
And I actually think I would be like that. If I was to break this up, I probably wouldn't go back for phase 2. So you're a brave girl, Tiana, having 2 surgeries.
Oh, it's amazing how resilient we are, honestly.
Yeah.
Like you would do what's necessary and you will do this. What else has been on your mind? So like, yep, the fear of the unknown, that makes total sense. And I definitely felt that way. But like, what else is coming up for you?
Well, everyone's got sort of different medical stuff going on. But for me, like, I have certain risk factors I'm more prone to sort of DVTs and things like that. I know a lot of lipedema girls are, but for me, I have a separate issue. And so for me, I was like, oh my God, what if I actually don't wake up? Like, what if I leave my children an orphan and have to tell everyone that their mum died during liposuction? I was crazy thoughts, like absolute insanity. I'm just like, and then I've had other nightmares, like just intrusive thoughts, right? I wake up and from my surgery and it's like I only got 2 liters. It's like I did all of this for that, like, and then you start to get fixated on. I see things online, like so many women, different scenarios, and obviously different surgeons around the world. It's some people getting like 15 to 18 liters in one single surgery, and I'm like, wow, that's like there's just so much variation. I'm just like, him not being able to say exactly how much. I'm like, but sir, how do I how do I know if I'm getting my value,
Yeah, it's like craving that reassurance.
Yeah.
Yeah.
And your
Yeah.
expectations, like, what should my expectations be? Like,
That's
when
it.
you met with your surgeon, did he go through that? Like,
Yeah.
he
Yes.
did? And
Yeah,
what was
he
he
did.
sort of saying to you?
And bless him, he has explained the same stuff to me, I would say 4 and 5 times. And he does it with a patient heart every time because it's like, okay, she needs to hear this again. Bless him. He's explained the process of liposuction for lipedema, and there becomes a point where it's ineffective, nothing more is coming out. And you are receiving blood through the instrument, and that's no longer safe. You need to stop, move to a different area. And, once all the areas aren't being effective in producing good fat
Yeah.
or lipedema fat, it's not actually a safe surgery at that point, and you need to stop. So he did also explain, like, these leaders that people get, they're mixed with different things, like the water that they use, tremesiant fluid, which is used to help, like, anesthetic wise. Also, blood is weighed in those bags. So it's a very deceptive tool, like a metric to use. So he really just discouraged me from focusing on leaders because
Yeah.
it's like we want an overall reconnecting. We want an overall good result. Because he's like, I could also go and take 25 liters out and you be very unwell, number one, and two, look not
Terrible.
right
Yeah.
and
Yeah.
be very unhappy. So it's about getting enough out, leaving some so you still maintain your shape and aesthetic aspirations.
Yeah.
So it's balancing all those variables in my head because I'm not even a black and white kind of person. Like I definitely, have flexibility, but I can't imagine it. I can't imagine my new legs. I just can't. So I think I wake up and go, oh, 2 liters. Maybe that's enough. But I mean, it might be 10 liters. I have no idea, but it's just like getting over the bridge to the other side seems like I can't even imagine it. But my anxiety has been a lot of just unknown. And now that I fully understand the process, like he drew me so many pictures and we were doing like, my numbers at one point. It is like, this is what the fat looks like and this is what blood looks like. And it's just so a full anatomy lesson. And after that, I felt more comfortable because I think for me, I really need to understand the procedure.
Yes.
And I just kind of didn't because everyone has such a different procedure and a different experience. So yeah, I don't know. Anxiety is a funny thing and it comes in waves. And I also just such an active person. Like I'm walking every day. Like I've got 2 young kids. I'm so busy. Having to be stationary for a bit's bothering me.
Yeah. Like what that recovery is going to look like as a
Yeah.
mum to young children. Yeah.
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 And I don't know, do I have enough time off? Like some people are back at work at 2 weeks, some are taking 6 weeks. It's such
So
a
individual.
so just gonna have to play it by ear and hope for the best. And he does think that me being an active person will benefit me in my recovery. And he said the quicker you can get back to being active, the better, even if you do have to push yourself a little bit initially, because it's sometimes the fear, like people are scared that they can't move, so they don't move, and then they get stuck in a bit of a cycle. But my anxiety's gone, and now I'm just sort of excited. I just can't wait for it to be here.
Yay. Can you talk us through like your plan? First of all, have you started packing and what are you packing?
Well, I haven't started yet. I've got a little basket of bits and bobs, but I haven't popped them in a bag yet. But I'm actually only in the hospital for a night, so I don't need a lot. I haven't thought a lot about it's when you pack your baby bag to go, you need so many things. I just figure I'm going to need something warm because the hospital's cold, my compression garments. So they give me one, but I'm going to take a second pair because he did say the next day that they'll get me up and help me shower and all that, which is lovely because I don't want to I'm so scared. I struggle getting compression on now. I don't know how I'm going to do it when I'm bruised and sore.
They do it for you. It's amazing.
Okay, so they might be a
And
lot
then
more
don't touch it.
experienced.
Yeah.
Oh, you don't touch it.
I think
Just
you have
leave
to
it.
leave it on, don't you, for
Yeah, well,
a few
I
weeks?
showered in mine.
Yeah.
I showered
You
in
shower
mine.
in them.
Yeah. and then like you use a hairdryer to dry them off and stuff. But each
Okay.
proceduralist has different protocols, so that might not be the same for you. Are you coming back home after your one night in hospital?
Yeah,
Yeah,
I
okay.
am. And my husband's got a week off, so
Nice.
he'll be my carer. I don't
Yeah.
think he knows what to expect. I think he just, I think he thinks it will be like, after you've had any kind of surgery, you're just sort of sleepy. But I think I'm going to get a little bell.
Yes. You're probably going to need one.
He's going to be doing a lot more than I think he usually does. So no, I've got lots of help, and my mum and mother-in-law and everyone. I'm sure my house will be filled with people helping me, which is great. I'm very lucky. But yeah, I did have the option to stay longer, but I know you girls have spoken about this on the podcast before about this being a very expensive procedure. It's an uninsured procedure, so it's in a private hospital, but you're paying per night to stay. You actually don't need to stay, but he requires you anything over 4 liters. They do recommend you stay one night for fluids. So I assume I am getting more than 4 liters.
Yeah.
Because it is still a high risk procedure. I think you need at least a night in hospital. So I would love to stay longer, but it's just too expensive to stay. But if I have to, I
is
will.
not an environment where you want to be recovering.
No, when they're coming in every couple of hours to do your obs and the lights are always on and
It's not. I was thinking, Guy, whether you were going to stay in a hotel or something with your carer.
Now that you mention it, that's a really good idea.
Yeah. I'm just thinking about the kids because your kids are similar age to my kids and they still love you at this point and like they want to be around you and so they're cuddling you and jumping on you and whatever, like, ow.
Why didn't I think of that?
get one close to the hospital so you're like, well, we need to stay here just in case there's any complications.
Well, I might pitch that tonight.
I'm sure your husband would love that, but he does need to do the grocery shopping, prepare 3 meals a day plus snacks, pick you up off the couch, make sure he can help you up the stairs, potentially help shower you and get you up off the toilet.
Gosh, and it's like his 40th birthday while I'm in recovery.
Oh, is it really? Happy birthday.
And I think we're going to be hosting some sort of party here. So I'll be on the couch while everyone does everything. I'm just here. So, but life goes on, right? That's a pure example of life just goes on. And Dr. Watson, he said, in his experience, women just get on with it. They are very resilient and capable, and your recovery can be as easy as difficult as you want it to be.
Yeah.
So, I mean, easy for him to say he hasn't had this procedure.
Right.
But
or had kids.
Yeah.
But I think what he's trying to say is, women are strong and we'll just find a way always.
Yeah, you will. And it's the emotional roller coaster because movement is like, as much as it's physically difficult to do, it helps move everything around. So it's absolutely necessary for your recovery.
Yeah.
But it's that knowing that the things that you can do and you're not able to, or it's much more difficult, or it takes more effort to do in this short period of time, especially with your kids there. Have you spoken to your kids about your surgery?
Well, yes, they've been told that if they aren't helpful and on best behavior, they're going to grandma's for the entire school holidays. They've been so good, and they've done a little roster of how they're going to help me. It's super cute, but I mean, if it's not going well, they're going.
Thank God for grandparents.
Oh my gosh, I don't know, and that's why I'm just not that worried. If it's not going well, just ship them off. It's okay. Yeah. But I'm actually, my biggest concern is how I'm going to get up my stairs.
Yeah. Do you have stairs to get into your house entryway
or bedroom?
Up to my bedroom, and I really just want to be in my bed. My MLD therapist, she did say you'll be able to do it. You'll just do it very slowly, so you wouldn't want to be doing that multiple times a day. So, like I said, I'm going to get my little bell.
Sit up on your bum.
How many stairs are we talking?
Probably 10.
Yeah, you'll be okay. Just don't come up and down and up and down. So I stayed at an apartment after my surgery, and from the car park to the apartment that we were in was 2 flights of stairs. And you can absolutely do it. It's just slow. You have to be slow and purposeful, and it's uncomfortable. You feel like you've run a marathon. Your legs are super uncomfortable, but you can absolutely do it.
Okay, good.
But I wasn't going out multiple times a day. So
No, I think once I'm in my room, I'm here to stay. I'll have the bell and I'll be
Yes.
using it. I have an ensuite. I've got my walking mat up here. I don't need to leave my
Yeah.
room for 3 weeks.
Yes.
Yep, food comes to you,
Yeah.
drinks come to you.
Yeah.
Yeah.
Yep. I've actually have got in my Amazon cart a bar fridge.
So fun. Yeah.
I think I'm going overboard, but yeah, so I can't wait for it to be over. It's interesting to like be excited about, but you know when you've been waiting for so long, and obviously it's been years in the making, this decision, and yeah, just getting to this other part now. It's bring on the bruises. I'm ready.
Bring on the bruises.
Yep.
Can you talk to us about what happens? Like, it's Dr. Luke Watson, right? What's his protocol for you after you are released home from your surgery?
I don't know the ins and outs, but I do know that I will be going back to him for post-op care. So I think that might mean 1 or 2 visits within that first month because Dr. Watson uses stitches. Some surgeons will leave the wounds open. He said I will still have some leaking, but his method is to use stitches, which from an aesthetic point of view, you do get a better scar. So that's good. And the fluid can still come out. It's not such a tight stitch that, so I imagine I'd have to go back to get them removed. But he's got nurses in his clinic that are available for me to call and communicate with for anything I need. And I think they'll be checking in every day. In terms of in the hospital, I know that I need to be up and moving as soon as possible. So
Yeah.
I think I don't know if they wake you up or do you just wake up after general anesthetic? I don't know.
They let you wake up in the recovery area.
So after that, then I think I'll have to walk up to my room. I don't know. I don't know about that.
Off you go.
But he did say like your best chances of reducing any kind of post-operative risk is to move straight away with any lower limb procedure, not just lipedema surgery, but that's the same if you're having any kind of procedure on the lower limbs. You don't want DVT. That's not what anyone wants.
Yeah. And you
Yeah,
want
so
to
I'm
get those pathways all moving again after
Yes.
they've been, deadened, in other
That's
words,
right.
knocked out, and now you got to,
get everything pumping again. But no, I'm not actually 100% sure about the post-op protocol. I'm sure he'll give me those instructions afterwards. I think he's also conscious of not giving me too much information because he's had to explain things so many times. He's like, she's not going to remember anyway. I might just have to just tell her at the time.
If you're going to see him again, bring your husband, and your husband needs to take notes because that's his job to work out what your post-op protocol is.
I did take my husband yesterday. And I was like, Luke, meet Stephen. He doesn't have lipedema. And she just laughed. And then my husband was like, are you calling me skinny? I was like, yes, I am. So funny. Yeah, no, very excited. And hopefully all goes well. And yeah.
It will go well.
Yeah.
Curious about what Dr. Watson said as telling you about how often you have to wear your compression. Like, what does that look like?
So his protocol is 3 months.
Mhm.
I know some surgeons are like 6 weeks or I don't know. But yeah, his is 3 months post-op, 6 weeks, 23 hours a day, and the next 6 weeks, 8 to 10 hours a day. So that's going to be fun. But I've been wearing them leading up as well. He did say like the more you can wear them, the better, mainly for you to get used to them and how you will wear them under clothing because they're going to be such a big part of your life.
Yeah.
Also, just, help keep that fluid moving and, loosen some of the tissue that can be helpful for good surgical outcomes. So,
soften everything up.
So I've actually, it's been fine, except this morning I put a nail through one of my favorite pairs. So I should have been wearing my gloves, but anyway, I was trying to do it in a rush. Yeah, but I'm so used to them now that the compression parts, I was worried about it, but now I'm just, it's just a nothing thing to me. But yeah, 3 months, so it'll go past quick, and then by summer, I should be out of them.
More question, and then
Then we'll let it go.
Oh, yeah. Well,
Okay.
unless you have more questions, but I've sort of taken over. But I'm curious about what he wants you to do, if anything, for MLD, or if you have MLD planned and what cadence.
I do, and yes, he's a big advocate for it. He said it helps tremendously if he's like, if patients can't commit to MLD, they probably shouldn't have surgery, because it's really important for fibrosis and detecting seromas, and it's really just a great tool that he definitely recommends. So I will be going to see the MLD therapist as soon as there's no more leaking. I can see her, and I'll be seeing her twice a week for the foreseeable future. I think
Twice a week. Cool. Yeah.
Did you see her? Did you see them twice a week?
Yeah, I think it was twice a week, and then she was the one that determined whether we could spread it out a little bit.
Yeah.
For my recovery. Yeah.
And I think that's, I'll just be guided by her. Like, she'll see it. She sees it all the time. So yes, but it was funny because I was talking to him about how I had been on the podcast, and he had said to me, "I've not heard of the Lipoedema podcast. That's really cool." He's like, "Yeah, it's great that you have these resources to tap into." And I thought to myself, you girls should have him on the podcast, because it's like he'd be great to chat to. Yeah.
Yeah, let him know. We want him.
Yeah. In your like before you go under GA, just be like, by the way, you have to go on the Lipoedema podcast.
Yes.
Take a flyer.
I think I did say to him, you should go on there. They get surgeons on there all the time, and he just kind of smiled. He didn't say no.
He didn't say no. That's a yes.
He doesn't say no to much, to be honest. He's so chilled. He's actually a cool guy. You'd have a good session chatting to him. He's got really interesting ways to explain things.
Yeah,
He has
cool.
good analogies, which I like, because
I love analogies.
I love analogy.
I love an analogy.
Me too.
And good picture drawing. You need a little whiteboard for you.
That's nice. Yeah. With a diagram.
Oh, that's
Yeah,
funny.
we will have to get it. Like the more proceduralists and surgeons we get on, the better.
Yeah.
Just, I have had actually a couple of listeners of the podcast message in recently asking specifically about Dr. Watson, and
I've actually had a few, messages come through, like on Facebook from people I don't know asking about him. So they must be listening. They're listening. They do tell me they've listened to the episode, and
good.
which is great. And he said, it goes, I feel like I've been seeing a lot of lipedema patients lately, and that's how I said to him, I was actually on this podcast, and I wonder if I'm promoting your business.
Absolutely.
Yeah, how about that kickback?
Finder's fee, please.
Yeah, exactly. How about that discount?
I think I probably owe him more money for pain and suffering.
Well, you're even then.
Yeah, that's right. Yeah,
absolutely. But yeah, no. This is a funny episode. This is more of like just a bit of a banter, but I think if anyone takes anything away, it's anxiety before surgery is totally normal, and not knowing what to expect is normal. If you trust your surgeon, and you really trust your surgical team, then it's going to be a good outcome, and what will be. You can't control the leaders.
Yeah.
Which sucks.
Yeah.
Yeah, and more
Not
liters
like going
doesn't
to
always
Coles and
equal a
buying,
better result.
a 2-liter bottle of orange juice.
Yeah.
You're getting 2 liters.
Yeah, it's not the same, but it's also, more liters doesn't equal a better result, and wrapping your head around the fact that they know what they're doing, and you can't. I'm just like, just give me the little stick, I'll do it myself. No, it doesn't work like that.
But he'll make sure that you have the best outcome you can have.
Yes.
Yep, absolutely. And then
all we can do is get ourselves ready for the table.
Yeah, and now I got to start packing my stuff. Any suggestions of what I should take as a seasoned person?
Oh, so the leaking. So I use period pads on the incision site, the open wounds that leak, but I also used puppy pads. Like if you want to come downstairs or even on your bed, put the puppy pads down on the bed in your leg section so that any leaking doesn't go like through to your sheets and stuff. Just protect your furniture. Like if you want to sit on the couch, put it on the couch, change them regularly. I even used like when I was leaking a lot, I used like plastic rubbish bags and tied them around my legs so that then the fluid would be caught down. I had stitches in my incisions too, but the ones around the ankle were left open, so it all flowed and came out the bottom.
Yeah.
Okay.
And then I went back and got a DVT check and my stitches removed, and I don't think they were in the same session. I think it was 2 separate sessions. And so lots of things to make sure you feel like you're not just leaving fluid around the house. But
God. How long does the leaking last?
Like a week.
Okay, so no visitors.
And you'll be oozing.
You'll be oozing. Yeah. Like a chair in the shower is handy.
Yeah.
You'll feel really tired. Like
Yes.
showering, getting dressed for the day, all of those little things will be quite tiring for the first
Yeah.
10 days. And yeah, so I showered in my compression. First of all, because the protocol was 24 hours a day for the first week, I think. So it wasn't 23 hours a day like yours was. But if you do take your compression off to shower, sit down because
Yeah, he did say, I remember him saying the reason you need a fresh pair of compression every day is for infection and so that you can actually inspect your sites to make sure there's no necrosis or anything sinister starting, because if we can't see it, probably wouldn't know. But no, yeah, he's like, don't take the full hour. Like as soon as you can, you get them back on.
just
Yeah.
have a little break.
Yeah.
Yeah.
So, but
And
it's
look,
probably going
did
to take me an
change
hour
my
to get them on.
literally. I did change my compression, but it took a long time, and the first few days I was going back and forth, like to the clinic to get checked. So they took off my compression, and then they helped me put it back on. So
Yeah, see that makes total sense. But I guess because I'll be at home and doing it myself.
yeah.
Gosh. Yeah, you might need to come round.
Yeah, I'll just come and help you put your compression on. Diane and I live about 200 meters away from each other, and our kids go to the same school, which we found out like while we were doing the podcast episode when we were speaking.
So crazy.
So
Such a small world, and that's what I actually love about this lipedema community. There's actually another girl who sees Dr. Watson for the same surgery on Tuesday next week, and we're in contact, and she's my little post-op buddy. And when I saw him, I was like, oh, you've got Emma next week. And he's thinking, how do you know my schedule? It's like, all the lippy girls know each other and we all talk to each other. So he's just like, is this some sort of cult? So you're the star member right now for Brisbane. So do us good.
yes, exactly. You're on watch.
Yeah, because we'll be
You're on
reporting
watch.
back.
Yeah.
Love that. Well,
Funny.
all the very, very best
Yes.
for 10 days from now. We can't wait to hear from you when you're on the other side of this.
Oh, I'm
And you
excited.
tell us how amazing the experience has been. Yeah.
Thanks, girls. And yeah, thanks for everything. You have given me so much encouragement, and Dianne listening to my freak outs. It's very kind.
It's validating because I felt the same feelings. So I was like, yep, that's normal. Yep.
That's normal. Now come and share it on the podcast.
Yeah.
Always here for a yap, you know me.
Oh,
All right, girls. No worries. Talk soon.
Lipedema and its symptoms vary from individual to individual. The opinions and advice voiced in this podcast are of a personal nature and used for educational purposes.
Please take away from this podcast what resonates with you, and please see your GP or preferred specialist for diagnosis and healthcare. We are Shelley and Tiana from the Lipedema podcast. Until our next episode, bye for now.